to say that I was almost brought to tears.
First of all, I think there was $130 million in cash that transferred from the Columbus airport to the Minnesota airport and then to Somalia.
Has Somali immigration been good for Ohio?
You know, that's really outside of my purview.
Criminal rings. We did a lot of work previously this year on Medicaid fraud in Minnesota. There seem to be a lot of similarities here. Can you tell us in your investigation, have you found any connections between Ohio Medicaid fraud and the Somali fraud that we saw in Minnesota?
Yeah, it's the same people. They all have relatives in both places, and they move back and forth. First of all, I think there was $130 million in cash that transferred from the Columbus airport to the Minnesota airport and then to Somalia. And so they're moving basically briefcases of cash. And there's one guy that had, basically he racked up $30,000 in tax debts in Columbus running this daycare center and not paying his taxes. So then he started a home health care company in Minnesota, billed $35,000 in 1 month, and then dissolved the company.
So I just want to be clear, your testimony is that there is a large interstate criminal enterprise of Somali fraudsters that are defrauding the federal government in multiple states of potentially billions of dollars. Is that your testimony?
Correct.
And can you give us a sense of the scale of this fraud? We saw it in Minnesota, we're seeing it here, but have you seen it in other places, or can you give us a sense for either dollar values or the number of people involved, in your opinion?
There's thousands of people involved. I would say the majority of Bhutanese people are either on Medicaid home health care or are providing Medicaid home health care services. They had recently 15,000 people. This nonprofit group, this advocacy group, which is tied to actually founded by a home health care guy. They had 15,000 Bhutanese people come to this party in Ohio, and they'd bust in all the participants on their Medicaid vans because everybody there has their own Medicaid company. And so I think Bhutanese people are systematically using Medicaid, not only in Ohio, but also in Pennsylvania and Kentucky and New York and in other states where they perceive that they will pay the family member and they will pay for non-nursing services. And those are the two big vulnerabilities.
So it's not just the Somalis, it's also Bhutanese. It's across multiple states. They're coordinating with each other. There's a network of foreigners running criminal fraud rings within our government, within our country, I should say, defrauding our federal government. Senator Antonio, thank you for being here. Has Somali immigration been good for Ohio?
You know, that's really outside of my purview of
You're a state senator. Would you like to see more immigration from Somalia?
As far as I'm processing your question, and I have to say that I was almost brought to tears just now.
72% of Somali immigrants are on welfare.
The rate and the level of hateful rhetoric based on
defrauding
false
your state
information
at an astounding rate, and I think that most Ohioans
is
would have a
shocking
problem
to me.
with that.
The lack of even humanity to
I think it's
a group of
inhumane to allow
people
your
together.
own state to be defrauded at astounding rates.
I am shocked
Billions
and
of dollars
appalled by the
taken out of the
behavior
pockets
here
of
right
working
now.
class people
I am
going to
shocked.
criminal fraudsters.
Because
I certainly have a major problem
in every
with that.
community,
I think
there are
that's an
good
issue, and I think
people
most
and there are
Americans
bad
agree.
people.
Chair, regular
There are
order.
But to
good
try
people.
to
Understand we're not
say
supposed to
bad
disrespect.
people.
We're not supposed to
And
disrespect
with
our
that
witnesses.
said, we are out of time,
member
Ms.
of a group
Antonio.
We're not
is
supposed to
somehow
disrespect.
a
We've already gone
criminal
over here.
is shocking to me. I am shocked and
We're
appalled.
already
The debate surrounding Medicaid fraud has continued beyond this hearing, with federal oversight efforts remaining active. Since the June 3rd hearing, the House Oversight Committee has continued examining fraud risks in Medicaid waiver programs, while the U.S. Department of Health and Human Services Office of Inspector General has released additional audits and enforcement actions highlighting weaknesses in Medicaid oversight and the need for stronger safeguards against improper payments. However, there have been no publicly announced federal findings or court rulings that independently confirm all of the specific allegations made during this exchange, meaning several of the claims discussed remain allegations presented in congressional testimony rather than established legal conclusions. Against that backdrop, this hearing showcased a sharp divide over how lawmakers should address Medicaid fraud. Representative Brandon Gill questioned investigative reporter Luke Rosiak about alleged connections between suspected fraud schemes in Ohio and previously reported cases in Minnesota. Rosiak testified that, based on his investigation, organized groups exploited weaknesses in home and community-based services programs by creating companies that billed Medicaid for services under limited oversight. Those allegations formed a central part of Republicans' argument that stronger verification systems and tougher enforcement are necessary to protect taxpayer-funded programs. At the same time, the hearing did not establish those allegations as proven facts through judicial findings or official government determinations. The discussion then shifted from financial oversight to the broader political debate surrounding immigration and public rhetoric. Ohio State Senator Nickie Antonio strongly objected to broad characterizations of immigrant communities, arguing that criminal conduct should be investigated and prosecuted without assigning collective blame to entire populations. That exchange illustrated the committee's fundamental disagreement. One side focused on identifying alleged patterns that they believe warrant aggressive investigation, while the other warned that enforcement efforts should remain evidence-based and avoid generalizations that could unfairly stigmatize law-abiding communities. Looking ahead, the larger policy debate is far from over. Congress continues to examine ways to strengthen Medicaid program integrity, and federal watchdogs are issuing new recommendations aimed at improving oversight, provider screening, and fraud detection across the healthcare system. Regardless of political differences, both oversight investigations and federal audits indicate that preventing fraud while ensuring eligible patients continue receiving care will remain a major issue in the months ahead.